Adversity Psychologist Podcast. And I'm super excited today because I have someone I've known really long time. Is that all right to say? So I have Dr. Michelle Gregory with me today. I'm going to let her introduce herself and tell us a little bit about what's brought her on today. Hi, Michelle.
Hi, Tara. So I'm Dr. Michelle Gregory. I'm a clinical psychologist, and you knew me when I was in my final year of training.
I did. Yes.
In Croydon. That's very exciting.
Lovely Croydon. Happy days. Happy days.
Yeah, absolutely. And so my area of expertise and my area of passion and specialism is functional neurological disorder, as well as long COVID, and also thinking around the complexities around that, particularly how that influences women and non-binary people or people of colour or neurodiverse, or how that interacts with neurodiversity. That's kind of my bag. And yeah. So and just thinking about just health inequalities can sometimes be exacerbated. And anything thinking around the mind, brain, body connections is sort of my thing. I love it.
And I love brain-body connection because it's really good for the public to start to understand these links, to be able to make sense of what they experience and where there may be some roadblocks in that. So there may be some people listening.
Yes.
Who kind of go, well, FND, what exactly is that? And we were talking before we hit record, weren't we, about actually sometimes it's useful to know what it is, but what it isn't, because there's a lot of kind of misunderstanding, I feel, around what FND is.
Absolutely. Which, so functional neurological disorder is the most common neurological condition no one's ever heard of. Shout out to FND.
Wow, that in itself.
Yeah. So about 40% of people turning up to outpatient neurology appointments have something called functional neurological disorder.
Is it that high? Wow.
Yeah. Gosh. And it's common, it's potentially reversible, and there are effective treatments. However, they're not always easily accessible. So what functional neurological disorder means is that the structures of the brain are healthy, the structures of your muscles are healthy, but the connections between what your brain's telling your body to do and what your body's telling your brain have gone a bit wonky, essentially.
Right.
There's a technical term for that. So it's not a hardware problem, it's a software problem, and the software can glitch. And essentially it's a disorder of voluntary movement, and it can have a really wide range of symptoms. So it can include, and the symptoms are debilitating, and they can be really frightening if you don't know what's going on. So they can include paralysis, tremor, bladder and bowel issues, so struggling to either contain urine or feces or actually release it as well. There can be vision issues, sensory processing issues, balance issues, like high levels of tone, or like an altered, like how people walk. It can affect, if there is a connection between the brain and the body, there is something that FND can connect. Also non-epileptic seizures as well.
It's a really broad spectrum, actually, isn't it? And I think that's something that people maybe don't understand.
Yeah, and actually you can have multiple symptoms as well. Functional tics as well is really, particularly for younger people, back in 2020, 2021, when the pandemic was really tricky. It was really difficult. There were lots of young people presenting with functional tics. And
we saw that all over the media, didn't we? And people were saying, is this anxiety? And my thought was like, is it, or is it something different?
So one of my bugbears is saying that these complex interactions are just anxiety, and it brings us on it. So functional neurological disorder is a neuropsychiatric condition, and you have to hold in mind both things. It is both neurological, and there are neurological underpinnings to it, but there are also psychological underpinnings to these presentations. So, and you get a little bit of a double bubble with me, Tara, because basically I am both. This is my area of clinical expertise, but it's also, I've got lived experience as well. So I recovered from FND. I developed it in 2019, and I was fully recovered just before the pandemic hit, about 2020. Thank goodness.
Which is lovely to hear. I'm really glad about that.
And about 40% of people make a recovery in the first year of functional neurological disorder, but getting an accurate diagnosis is key to that. Yeah, it's so important.
Are there roadblocks? Is that all right to ask in getting?
Yeah, there are particular roadblocks to it. Is first of all getting a neurologist who understands FND and can give a really positive diagnosis. So I was really, really lucky. So I started developing unusual symptoms. So my eyes went really blurry. I couldn't focus them. I was at work one day, I was having supervision with a trainee, and my eyes went really fuzzy. And I was like, that's weird. I can't refocus my eyes. That's really weird. Called an ambulance and went down to Worthing A&E. And then while I was waiting, my leg started not being able to move. And I was like, okay, that's weird. I could feel it. I could move my other leg.
Gosh, yeah.
My right leg couldn't move. And I was like, that's weird. And lasted about 5 minutes. And then I was able to move it again. And then I started developing speech issues. So my speech became really slurred and dysarthric and quite stuttery. And it was really, really scary. I had no idea what was going on. And because basically we're just used to our bodies and speech just doing what we need them to do. Right. And this is where sometimes a little bit of knowledge can actually be worse than none. Because I was going through my Rolodex of, Rolodex, how old am I?
The curse of being a psychologist, yeah? What could this be?
Yeah. Is this MS? Is this Parkinson's? Is this MND? I was 34 years old at the time. I was like, I don't know what this could possibly be. I was really lucky. I went to my GP, and my GP was of a similar age to me. And she was like, okay, this is serious. Let's go get you on a 2-week referral over to neurology. And I went up and I saw a neurologist at East Surrey, Dr Shrikanthan, and she was just amazing. And she really clearly did the neurological test and said, I'm going to give you an MRI just to make sure, but I'm almost certain this is FND, this is functional neurological disorder. Do you know what that is? And I was like, heard of it, but just something that's really rare, or or like it. No, not really. And she explained to me what it was. She said it was not dangerous. She said she essentially explained that it was a hardware problem, not a software problem. And she was like, so when the MRI comes back, I'll refer you up to London, or I'll refer you down to Brighton for rehab. I was like, okay, all right. MRI came back and it was absolutely clear. Do not get me wrong, I still spent a couple of weeks trying to figure out how MRIs were wrong, because
which isn't, again, it's natural response, isn't it, to something scary and life-altering potentially.
Because I was like, well, because this doesn't fit with the social model of medicine that we are brought up with, where the more serious something is, it should show up on a scan, it should show up on blood tests, and there should be a clear treatment plan,
like definitive,
Yes. Yeah. And so the scans came back clear. I got a confirmed diagnosis of functional neurological disorder, and I was referred up to St George's. Unfortunately, it was a 2-year wait. Yeah. So if we're thinking about barriers to getting a confirmed diagnosis, I was articulate, a white woman who had similarities to my GP. I looked like my GP, and I had a similar educational background to GP. I also was really lucky with the consultant neurologist that I saw. She really got it and gave me a clear. She didn't go, oh, it could be this, it could be that. Let's send you off for lots of different tests. She was like, this is what it is, and I'm giving you an MRI to help you know that there is nothing structurally wrong with your brain. I'm like, great, thank you. If you are not white, if you are, I think women and non-binary people tend to be our pain tends to be overlooked, or our symptoms tend to be overlooked by medical professionals. I was also able to do my own research and understand that. I also had access to psychologists as well, who I could kind of ask. So
that's a really good point. Yeah.
And actually, one of the most helpful things I had when I was recovering was I was an associate clinical tutor for Surrey University, and Noelle Blake, who we remember from
I know her.
Neuro Services. She was in one of those meetings when my speech was going, and I was like, just let you know, my speech goes, it will sort itself out, but just kind of go with it. And then she was like, oh, this is FND. And I was like, yeah. And she's like, I was like, have you got any hints or tips you can give me? She was like, exactly what you've been doing, just name it and it'll pass. Not avoiding, because there was a certain amount of times where I was avoiding seeing people,
which is understandable and natural.
Because I didn't know, because the other thing around functional neurological disorder is that the symptoms can be really unpredictable and they can fluctuate. So at its worst, I remember lying on my bed, not being able to speak and not being able to move any part of my body.
Just what that is like, how your brain goes into threat mode around that.
Exactly. And if I can be a bit geeky about how it's basically, yes, our brain goes into threat mode because essentially these neurological symptoms are new and they're not understandable. Why wouldn't your brain go into threat mode? And then also, so essentially functional neurological disorder is a disorder of attention. So what happens is your brain is predisposed, particularly when you're in threat mode, to pay attention to things that are not working well or not working as you would predict, like you're not being able to speak as you would think you would be able to, or not being able to move or not being able to stop moving if you've got a functional tremor.
Things that we take for granted, as you say. Things that help you do your job or interact or whatever you need to be doing.
Absolutely. And so for me, the paralysis wasn't actually the most debilitating symptom. It's my speech, because that meant I couldn't do my job. And I was like, can I be a psychologist if I can't speak? I don't know. I genuinely didn't know if I could carry on working. And then
just how that is for somebody where you really value your career and what you can do for other people.
Absolutely. And for many of the people I see, what FND can do is it can act like a bit of a gremlin that almost targets the things that are so meaningful for you. So if you are really sporty and it means that you can't engage in the sport that you love, that can be really difficult. If you love school or college, but the pressure's overwhelming and you can't guarantee you can be in there, or it's not psychologically safe to be having to, then you might have seizures. That could be really, really overwhelming.
I was thinking, things like parenting, communicating with your partner, friends, the stuff outside of our kind of construct of who we are in a vocation setting.
Absolutely. So at the time, my daughter was 4 years old, and all we could do at one point was colouring. So we were colouring on the bed. She basically spent quite a bit of time on my bed, and we were colouring together. And it took me a little while to figure out what movements actually were, how things actually got my body back and moving, and that was essentially helping my clever, slow brain to turn itself off a little bit and trust my body, and being able to, what we call flow state, where you just can switch your thinking brain off and trust that your body knows how to do that. And for me, that was swimming, and it was standing, and because swimming, you don't have to think about it, and being in the water also gives your body lots and lots of sensory input. I knew exactly where my body was. I felt really like, and then my brain switched off and my body remembered how to swim again. And so that was something that we could do together, and it was just wonderful and it was lovely.
So trying to find that kind of value and purpose, even amongst all of that kind of fear and uncertainty.
Yeah,
as well.
Absolutely. So so part of what we do in terms of rehabbing for FND is essentially to change how the mind focuses its attention.
Yeah.
Because it can be, if you think about sensory regulation, emotional regulation, pain regulation, they're all interconnected. And this comes from, don't know if you've come across Dr. Jessica Eccles. The Bendy Brain account on Instagram. She's amazing.
I do some work with the Sussex EDS. Connected, yeah.
EDS and FND. They're EDS, FND, fibromyalgia, POTS, long COVID. It's all a bit interconnected, where essentially you can have really noisy nervous systems. And if your nervous system is really noisy, it can then be hard to figure out what's going on, because there are lots of competing signals coming up from a body that the brain can't interpret.
Yeah, there's that mind-body link. That's why that's so important.
Absolutely. And people think that it is the brain that tells the body whether to be safe or not. But no, the body can also tell the brain whether it's safe or not. And sometimes the brain...
That's probably really important for people to know listening to this, actually.
Yeah.
Again, we're kind of just deconstructing some of those myths or misunderstandings about what FND is.
Absolutely. So it's a connection. So it's not just the connections between the brain telling the body what to do. It is also, what are those signals telling the brain, and how can the brain interpret those? How can it interpret it accurately, and how can you predict what's going to happen? Yeah. So lots of what we do in the first kind of stages is helping people get a really clear understanding of what FND is. So in terms of, we can bust some myths, essentially. So it is not progressive. So it can fluctuate and it can sometimes get worse, but that is not because bits of the brain are progressively changing irreversibly.
That's really important to get across, because when you come back to that uncertainty and fear, one of the things our brain is great at, isn't it? It's fast forward to, this is the future and this is how things are going to be.
Absolutely. And it's because essentially the brain is adapted, and the brain's adapted essentially with the threat system of the brain has basically made too many instant connections with the motor cortex of the brain. And so threat, motor symptoms, or threat, changing tone in your body. So you can become really floppy, or it can change, or you can have different types of seizures, like more generalized seizures. And again, it's important because there is this overlap with functional symptoms and organic symptoms. You really do need to get checked out by a neurologist who can essentially... FND is also not a diagnosis of exclusion where you've ruled everything else out and then, okay, so it might just be FND. No.
Good point. Yeah.
There are particular ways in which FND responds that makes it a really positive diagnosis, that we know FND responds in that way. So if you've got a tremor and you are tremoring, and what we can often do is we can ask people, it goes away with distraction. So you ask somebody with a non-affected limb to copy you. And then because basically our mirror neurons start kicking off, and we are social animals and we like to copy what somebody's doing. So with that distraction, we can start repeating. And there's something very important about rhythmical, repetitive movements that help retrain the brain, make us feel safe. So sometimes it can be like, what do we do when we've got a little tiny baby? We rock, right? There is something very, very soothing around that. And so what can happen yeah, absolutely. And so when you've got this so essentially you are concentrating on a non-affected limb and you are copying what the person in front of you is doing, and then that usually results in the tremor stopping, because you are not paying lots of attention to the affected limb and you are concentrating on something that is unaffected. The other thing that you can also do is essentially this comes around to psychological mechanisms around performance anxiety or performance psychology, where you can guarantee you can trigger off FND symptoms by asking somebody to do a movement.
Yeah.
Like on demand, right? Can you lift your arm? Like, no. Whereas if you then threw a ball at somebody, you'd be able to do it because don't switches your brain off and allows your body to do it automatically.
I'm so glad this is visual, this podcast now as well. It's just auditory, so people can see what you're doing.
See, that's the other thing as well. I think in terms of dispelling myths, if anybody has ever had the yips when they are playing golf or like other kinds of sports, you've essentially tapped into certain mechanisms that are at play with FND. So we've all had that experience, haven't we, where some days you can just like hit the ball, kick the ball, shoot the netball in the net, whatever it is, and you just know exactly where your body's going to be. You can just like do it. You're in the zone. You're in this beautiful flow state. Lovely. And then you get days when you can't hit it for toffee, and you just like, and you get more and more frustrated. You focus on it more and more, and then it gets even worse.
That big cycle, as we call it, cycle of symptoms.
Yeah. And so that's what I always ask people. Have you ever had this experience before in a non-like threatening way? Yeah. What do you do? People inevitably say, oh, do you know what? I go away, I shake it off, and then I come back. And that's exactly what we want people to do when they are having motor symptoms. Don't hyper focus on it. Take a bit of time, distract yourself with something that brings you joy. It could be listening to a podcast. It could be speaking to somebody that you love. It could be having a bath, or it could just even be like rubbing some hand cream, doing something that is an automatic movement. And once that automatic movement comes in, it then starts to retrain your brain for those automatic movements to become where you don't have to think about it again.
So that's kind of then, I guess, impacting on that uncertainty and that fear, because you're taking the power out of the situation as well.
Absolutely. And what we do, the number one thing that we can do is provide psychological safety with the symptoms. So if they happen, you've got plan A, plan B, plan C, plan D, all in there. So, okay, if I am out and my speech starts to go, or my leg starts to go, am I going somewhere where I can sit down? Am I going with somebody who I can just say, like, actually, I'm starting to like get a bit fatigued, or my symptoms are starting to come on. Can you help me find somewhere? So I was also incredibly lucky because my husband was and is amazing. He had this just lovely balance between being empathetic and supportive, but not taking things away from me. So
kind of allowing your autonomy.
Yes, absolutely. I mean, it kind of had to happen because he travels a lot and he couldn't stop work. So I was being a single parent to a 4-year-old, so I had to do stuff. It may not have been exactly how I needed to have done it.
That kind of dealing with other bits of adversity that get sent our way.
Yeah. So I wasn't able to cook the home cooked food for a while because I couldn't stand up without getting wobbly for a while. But I did it and again, I have the privilege to be able to afford like ready cooked and ready prepped meals. So I basically lived off those pre-cooked salmon fillets, microwave rice and salad. Because I was like, that takes me 2 minutes, and I know it's healthy. I've got my protein, I've got my carbohydrates, and I've got my veg, and I don't have to worry too much about cutting a knife or cutting stuff with a knife or anything like that.
It's giving yourself a bit of compassion, really, a bit of space to just recover.
Which brings us on to what also helps us feel psychologically safe is if we can be turned towards our symptoms with kindness and compassion. We go, do you know what? Having a bad day today, and so I can only give maybe 20-30% today, but if I give that 20-30%, I've given all I can give today. And so
I love that model.
Yeah, absolutely. And it's having boundaries as well, by being able to say to people, do you know what, I can't do that, or I might not be able to do that today. So, or I might not, I want to come and see you, but hold in mind, I might have to like bail at the last minute. So don't, but I will let you know as soon as I can.
And is it all right to bring in, because I just want to differentiate as well, because some people are really aware of this term avoidance, that sometimes we may just pull away from stuff due to fear, anxiety. This is different, isn't it? That model of what can I do right now? And there may be times when I'm not able, or I need to turn around and go home, but that's very different from pulling away. And I imagine there might be people with FND where avoidance does show up, and how you kind of just differentiate the two.
So for me, avoidance is not even contemplating it. Is too difficult to even think about it. So it's an automatic no before you've even thought about it. Whereas having boundary, because also the other thing is as well is that if thinking around neurological fatigue and boom and bust as well, that's also people who go beyond what their limits are because they feel like they have to or they should, and then they end up having a massive crash, or because it's too threatening to their sense of identity to be someone who is unreliable, or to someone who can't start and finish something. So quite often when we're talking about neurological fatigue, it's like, I am absolutely shattered, but I have to finish the dishwasher because I know I won't be able to rest. And all the time, while knowing that I've half done it. So I am halfway through doing this, but I have to finish it because even if I sit down, I won't be able, it will just be going round and round in my mind. And then what we do is we essentially say, so both have a cost, right?
Yeah, weighing it up.
And if you are mindfully choosing to push past your physical limits, because you know that the cost to you, but then you can fully rest after that. Are you doing it mindfully? I think this is also what we do. We bring self-compassion, we bring mindfulness and intention into when you have limited energy and when you have limited capabilities. It is thinking about, are you using your limited energy and things that you value, bring you joy, or speak to you, or move you closer to who you want to be as a person?
I love values. I do it all the time in my clinical work. And I think it can really help when you've especially if you might be a psychologist who's kind of familiar with FND, you may have a relative with it, but if you're someone who's never come across it, you can imagine just how much fear and uncertainty there can be. And sometimes it can be really hard to know where we've got control, and we might kind of doom scroll to the future. So to come back to values, I always think it's just the most positive thing you can have in a situation. What really matters to me, and therefore what choices do I have in this moment to help me try and move towards those?
Absolutely. And the thing around values is that you never actually get there. So, but it honors the intention of like the start where you're at.
Takes the pressure off the goal-orientated kind of society that we're still in a little bit, aren't we? I must do, got to tick it off, got to be measurable, attainable,
Hustle culture. Hustle culture. And you have to be productive in everything that you do as well. It can be so tricky. And I also forgot to mention another particular symptom of FND, which is brain fog, or functional cognitive symptoms, which goes across lots of people's experiences. It's not just an FND thing. So this is where essentially your attentional capacity is completely overloaded. So it's really hard to make decisions. It can be really hard to make decisions. It can be hard to use information. It might be that I remember not being able, I lost my keys in the house. I knew they were in there somewhere because obviously I'd got into the house. I had driven back, got into the house. They must be there somewhere. Could not find them. It was 5 minutes before we had to leave for the school run.
The most precious time of the day, or it's in my house.
And I was like, I have no idea where they are. And I couldn't problem solve it. I had no resources to be able to pause and to think and to where are my backup plans? And so I became and that actually resulted in me having a seizure, because I was just like, I am so overwhelmed. I am so, because in my head, it was not an option to be late for school.
Yeah.
And if you think about it now, like, of course it's an option to be late for school. Of course, like, what is the worst that will happen? But again,
I call it parent book of shame, as I call it. If you have to sign
yeah.
that book, if the gate is shut, our mind will place it on a pedestal. Do not go there.
How does everybody else get to do this? How is everybody else able to find their keys? Everybody else manages to do this with more children than I have.
So the good old comparison with others thrown right on in there as well. Yeah.
And so what we did is, again, my husband helped me, like, because he's very, very logical and very kind.
Having that support, someone else to just lean in with you.
Absolutely. And so what we did was and it's all these things that we talk about all the time. So I now have a place where I put my keys every time. That isn't guaranteed, because sometimes I will get distracted and I will put them various places. So what I have is a tile app on my keys, and I have a tile app on my phone, and then I either can find my phone or I can find my keys, and each one helps me find the other. I also have a spare set of keys in a drawer, which never goes anywhere. So it doesn't stop. Actually, now that I've more recovered, I do have more attentional capacity, and I rarely lose my keys as much. But if that ever happens, I don't get overwhelmed and I don't panic, because I've got the backup of, and that's what provides me with psychological safety.
So doing some of that kind of preventative, in a way, stuff, is thinking about what can I learn from this moment, but it might also be useful in future moments as well.
Absolutely. And what we do in the rehab is essentially make the symptoms understandable, takes the threat down, makes the symptoms predictable. Like this morning, mornings are probably like quite tricky for me, so I need quite a lot of structure to help me manage in the mornings. Okay, so then when it does happen, I've almost predicted it. So then I don't get into threat mode. So then I feel psychologically safe, and then I know what I can do to get out of this.
It's a nice pathway, that, actually. Quite accessible for people to try, and people listening now who may be brand new to FND or in the middle of getting a diagnosis or even further along the line. That's very accessible, very usable, isn't it? And very translatable, actually, to individuals.
Yeah, and what understandable looks like to you will be very different to what it might look like to somebody else. Because the thing is, because FND is such a variable condition, everybody presents with it slightly differently, and what works for different people is so you have to work in a really person-centered way.
Which I love, actually, because I think there's far too much out there at the moment of kind of one size fits all, sticking plaster. That's my bugbear. Just because actually it's really unhelpful for some people, because then they feel they're not doing well and I'm not doing what everyone else is doing, or why isn't this working for me? That kind of bespoke person-centered model, I think, is really refreshing, and might create more of a kind of a core shift in how you respond and manage your symptoms.
And what I've done particularly differently when I work with, how I've developed my practice since the time I've trained when working with people with FND, is actually I do far more somatic body up work. It works so much quicker than thoughts, because you can't always control the feelings. You can't control your bodily, these FND symptoms. And that's, I think, where sometimes, and actually ironically with FND, the more you try to control them, you try to force your way through them, the worse it gets. So
for people listening, is it all right to just clarify what somatic, that might be a new concept?
Oh, yeah, of course.
Some people.
Somatic basically means like what's going on in your body.
Okay.
And I can do a couple. Sorry, my cat's decided to join.
I love that. I was just going to say, we've got an extra visitor. Always love to see people's pets.
So I can do a couple of exercises, which actually we try to support people to create that body up sense of safety. It's basically the signals that your body does when we feel safe can tell your brain that you're feeling safe, even when you're in threat mode. And they're quite simple, quite easy to think about and implement. So we could try a couple now.
That'd be fantastic.
It's really
experiential, yes.
So if you think about it, when we're anxious, what do we do? Like our shoulders go up, we lean forward.
Shoulders are up to my earlobes when I'm stressed. Yeah.
Tense our jaws and our eyes are quite open, because if you think about it, when we're under threat, we need to be ready to go.
Yeah,
we need to be seeing everything. And also we start breathing really shallowly as well. And so what we do is we deliberately make an effort to do the opposite. So we kind of lean back.
I'm going to do it now.
Yeah. We take a deep breath. Close our eyes if we feel safe. And then give a very small closed mouth smile. Because again, we only smile when we feel safe. We can only close our eyes when we feel safe.
I love that.
And just invite to think about, what's that like?
Lovely on a Friday morning.
Yeah.
I could feel a little bit of sun on me as well, which is extra nice.
Yeah. And I've got quite a high energy, don't know if that's come across. And that just gives a little moment of...
Yes. We're quite similar on that level, aren't we? Yeah.
You'll be fine. And what that does is it sends safety signals to your brain. Yeah. And also you can do this pretty much anywhere where you're sitting down, and it won't look that strange.
Yeah. So it's really portable, as I call it. You know, you can do it wherever. And the chair's doing the work, which I like. It's just supporting you so you can allow yourself to just be in that moment, can't you?
Absolutely. And it also doesn't ask you to pay too much attention to what's going on in our body, because I think sometimes with traditional mindfulness exercises, they can focus too much on... Your body might not be a safe place. Your thoughts might not be safe. Your feelings might not be safe.
When you add all that together, that can then create. Yeah.
I do remember trying to do some mindfulness of thoughts when I was really dysregulated, and
and kind of part of this is educating people around that, because again, when we come back to that kind of sticking plaster model, sometimes that one size fits all, do this, do that. It's about finding out and testing what works for you.
Yeah. And so absolutely. So for me, it's sound, because it gets my attention outside of my body. So it's the one thing that helps me still and settle. So another couple of exercises I can do, and again, it might this is both of them. I try to do them to be quite portable. Yes, so I'm taking that, Tara, if that's all right.
Welcome.
Try and relax your tongue. Just see where your tongue is and just relax your tongue.
That never happens because I talk all the time. This will be a first on the podcast.
Notice where it normally goes and then just try and bring it down to the bottom of your mouth. Where does it rest?
That one.
Yeah.
It's resting.
Yeah.
Well, first, I didn't think I was going to get stuff out of this today. A lot of people listening to this will be like, yes, she's going to stop talking now.
But it works quickly.
Yeah, and it really does. Yeah. For those people who may be listening to us, if it's on the audio version, it really does. That was just seconds.
Yeah. Another thing as well, which works if you've got, if you're feeling a bit spacey or a bit, got some vestibular issues. Now, if you've really got vestibular issues, hold in mind that don't want to do this exercise and then you fall down backwards or anything. So just know your own.
Just for people that may be not familiar with the word vestibular.
Yes,
and what that is for people.
Yeah, of course. So vestibular essentially is around balance. So in order to know whether we're standing upright, our brain needs to be able to interpret information from our spine. If we're standing upright, needs to know information from our joints about where our body is, and also our eyes. And then what happens with vestibular issues is that essentially the information coming up from all of those three things are not vibing together. They're not being integrated in a seamless way. And then that can cause us to feel dizzy or if we close our eyes, like fall over a little bit because we're over relying on our eyes, or that horrible vertigo feeling. I'll be honest with you, out of all of the symptoms I've ever had, like vertigo, 0 out of 5 stars on TripAdvisor. Do not recommend it. But this comes from my colleague Lizzie Locke down in Brighton, who's an amazing vestibular physiotherapist, and what she talks about is essentially squeezing our shoulder blades together. So
you're listening, we're doing this now on our video version, aren't we?
So try that. And essentially squeezing your shoulder blades together, it gives you a really strong sense of squeeze that is in your control and gives a really strong message about where your spine is and where your body is. So what it does is it engages your cranial sacral system, so the bottom of your brain to the bottom of your spine, and it like strengthens it. Well,
I'm going to be doing that more and more often. Sometimes when you've been sat at your desk a long time or looking at screens, that's when sometimes you can notice some vestibular. I noticed a lot of people during the pandemic struggling with that. I'm going to be using that at my desk.
Absolutely. And then what that does is it gives our brain lots and lots of information, but we're in control of it. It's not happening outside of our control. And so that can help us feel grounded and safe. So
I've learned lots today.
Because what I want to demystify about functional neurological disorder as well is, and I know we're kind of coming towards the end.
We're going to have to do more episodes. There's so many things I want to cover with you. I've had loads of people that have come on for multiple episodes, and people really like that.
Absolutely. So what I want to demystify about is that it is a common condition. There are treatments, physiotherapy treatments, occupational therapy treatments, psychological treatments as well that can help people recover. Unfortunately, access to them is not always great, and that I think would be a subject for another podcast. But it is reversible. It also doesn't mean that you're mad. It doesn't mean that you are, because also part of the thing as well is that because it's fluctuating, it's really hard to be believed, and being invalidated is also a really key trigger for symptoms as well.
And I see that a lot actually in patients that I work with, that because as you say, it isn't something where you get quite bad and then you recover on this lovely line. That sometimes the people around them struggle with that, and there can be a sense of, am I not doing things right, or is this in my head? As you say, all of those myths.
And also if you need aids but intermittently, so again we think that people who need wheelchairs all the time, and then if you suddenly stand up out of it, what are people going to think of you? That's really, and so then it can strengthen that I need to stay in my wheelchair as well, which is, and then avoid certain situations where you might not.
That's a really good point.
Another myth as well that we need to focus on is, so I can't remember if it was John Stone or Mark Edwards. They're like the kings of all things. It's FND, but one of them said that trauma is to FND as smoking is to lung cancer. So it can be really lots of people who've experienced trauma. Well, lots of people with FND have experienced trauma. However, not everyone with FND needs to have a traumatic experience. And it's really important to think about that, because I think sometimes we can go, some people who don't know the condition particularly well can go trauma hunting almost. And so what's this hidden trauma that you've experienced? And for some people, it may be burnout. It may be that it's a bit of overwhelm. It could be that people have just not necessarily had the emotional literacy to name stress or overwhelm or anxiety. And then, and also sometimes as well, it can be debilitating for some people, but also where I get the most joy in my work is when I've seen somebody and they've had, say, for example, a functional stroke. They've turned up to A&E, they've had the scan, and they've gone, no, this is FND. And then I can see someone and I can give them some really good information to stop those kind of patterns embedding. And then quite often a one-off session is all people need. Quite often,
remarkable, isn't it? Yeah.
And this is where I'm going to end up ranting just a little bit, but I just can't imagine another condition where we would go, do you know what? We know what this is. There are positive signs of diagnosis. If you get early intervention, it can essentially prevent high levels of disability.
Yes.
But we're not going to provide intervention for it. And instead, we go for a 2-week waiting list in 2-year waiting list in a specialist centre. And here's a website. Good luck. On you go. I wish you well.
Staggering. It's the word that I would use.
Yeah.
Absolutely staggering.
And maybe the next time we'll talk about it being a feminist issue as well, because I think
that would be really important to cover. Really do. They kind of, because sometimes, on this podcast and as clinicians, if we catch up and talk, you can help people understand, you can help people manage symptoms, but they've got to get access to that information, and that's where there's often quite a big void.
Yeah.
How many people may be listening to this who are on that 2-year wait, and what kind of patterns and things are happening in that 2 years in terms of how they're responding to symptoms, and what kind of value-based living are they able to do while they're waiting.
Absolutely. And if you are waiting for a diagnosis, or if you have got a diagnosis and you're waiting for input, FND Hope is an amazing website. It's got some really good free resources and free.
I will make sure these are in the show notes. FND
Hope.
Right.
Yeah. They have free resources. They have free information sessions. The information out there is really, really good quality. They're a wonderful charity, really passionate. And also neurosymptoms.org. That's developed by John Stone, who is one of the world's leading experts in
I'm going to go look those up as well, because part of this podcast and the kind of philanthropic nature behind it is people having access. So we keep our show notes live so we can keep adding things. So most people listen to a podcast won't go and type something in the internet, but if it's there in the show notes, all you do is click. So whatever you're listening on, Spotify, Amazon, Apple, just go in the show notes and click. The links are all live and they stay live, and we can update them as and when. So kind of bringing on, obviously we've got those 2 great websites, but I know most people are going to be going, how do we find you? Where do you hang out? Because we'll add those as well.
So I hang out in Horsham. My private practice is called Chest Psychology Services.
So you're literally round the corner, aren't you? Which is fantastic from me.
Yes. So my clinic rooms that I use are opposite the library in Horsham, and I also practice a lot online, and I've seen people around the world. So it's
and they're super lucky that they get to see you.
It's a joy and it's a pleasure. And I thought we'd cover loads of. There's so much stuff that we haven't even touched. So if you would be willing to have me back on again,
Tara, do you know what we're going to do? I'm going to do one fairly soon if you're up for that.
And absolutely.
Tag them together. You're also on Instagram as well, aren't you? I personally like your Instagram account because you share a lot of really good knowledge, and you also dispel a lot of myths on there. So I avidly follow. Remind me, what's your tag on Instagram?
At Chestworth Psychology.
Right, so I'll make sure that's in there. I always ask everyone that comes on, we've had loads of nuggets. If there was one adversity takeaway that you could give us, what might that be?
So it would be... that's weird. So in terms of overcoming adversity, it would be learning to trust your body. Your body knows what it needs to do.
Yeah.
And trying to control what can't be controlled doesn't lead us to be stronger. We're actually stronger when we can be more flexible and have a wider range of options available to us, is what I would say.
I love that. That control agenda can be so dominant. It's like this kind of really unhelpful friend hanging around at times, and we can almost like battle it, can't we? But just being kind and compassionate, dropping that control agenda. I love that.
That's another podcast.
Yeah,
it's been a joy speaking with you, Tara. I do have to go.